Hello everybody, welcome back to this one more new video. So today we have got Tanya Vijay Jadhav. She is an third year medical student at Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research. So she has done very good in her academics. She has achieved distinction in first year, second year, and along with that, she has been very good in extracurricular activities. Like she has won first prize in KMC Manipal for the case presentation, and it is published under imprisonment. You can check it on Google Scholar. And even she has done many of the poster presentations where she has achieved second prize in Savita Medical College, and it's in the process of getting published. So that's the thing. We could hear it from Tanya. So she is very excellent in academics as well as extracurricular. So I found it as a very good opportunity to bring her on the video and let you guys know about all the things that how she has done all these things. So definitely this video will help you in some of the other kinds. So have a bit of patience and you can switch this video to 1.5x so that you can save your time. So let's get started. Hi Tanya.
Hello. Hi.
How are you?
I'm good. How are you?
Yeah, I am fine. It has been, I think, presently you are in third year and you have seen a lot of ups and downs through this medical journey. And how is your MBBS journey has been all these 2 years, first year and second year?
It was good. Starting, I was a little lost, I feel. First year, I was trying to fit in. It was too much just studying from the book, etc. Second year was much nice. It was more peaceful, I feel, because you're more exposed to the clinicals. So you understand better than just reading the books. So, and
Yeah.
with all this, doing a case presentation, etc., I feel it's it's a good experience. Overall, I feel it's been a
Yeah.
balance of both, I feel.
Yeah, balancing is very important because it's not only the books that you should be studying, it's even more than books. A lot of us, when we get in first year, second year, we are least cared about all the things which are actually important. Like it might be any of the things which are related to academics, though it might not feel very important at the present moment, but once you pass your MBBS course, I mean, once you prepare for the PG as well as search for a job in a hospital, or if you want to go abroad, then there will be some kind of CV where all your achievements as well as all your activities that you have done through your course of MBBS will be written. So that's where this all these things comes in importance, and you will know the true value of that all these things during that time. So let's hear from Tanya how important is all these things, and if you are someone who has never heard of anything like case presentation, poster presentation, research, or any other things, it might be related to academics. So let's ask Tanya how she has got started in case presentation first. So Tanya, can you just tell what's case presentation and how it's beneficial? And if there is someone, a second year student who is actually watching this, how can he get started with that?
So, if you're first thing is interest, okay? You need to have interest to actually know in depth of any case on a rare case. You know, there's so many cases comes to the hospital, and there's so many new cases in different regions. In certain regions, certain cases are there. So I feel stage fright. I had stage fright first thing. So I just wanted to go get over it. So I thought doing case presentations and all this will give me a better exposure while talking also to the patient also, because
Yeah,
over there you're talking to a couple of medical professional
students. Yeah,
professors, etc. And
yeah.
it's a good experience because even they ask you questions over there, and it will actually tell you to think, and it will test your
Yeah.
knowledge at the present.
At
Because
the
I have to know
moment.
one small topic, I have to know the entire array of it, like from
Yeah, you have to
source,
integrate
like from
everything.
starting. Yeah, like if it's diabetes, I have to check the pathology, I have to check the medicine part of it. I have to check so many other the lab reports, biochemistry also comes into it.
Yeah.
So many, it's an integration, and it'll teach you a lot. I feel you have to go talk to the patient, how they feel,
Hmm.
and it's nice, and you go to a different place also,
Hmm.
and different students, different
Hmm.
professors. So it's a good
Yeah.
exposure, I
So
feel,
if
if you want to
yeah,
start.
it's
Yeah.
so now how do I get started? Like if I want to take this up, like I want to do a presentation. then how could I start? I mean, let's suppose I have least knowledge of that. So how could I get started?
Okay, so I think what I did was,
Mm,
see, first thing is example, there will be a lot of events coming up. Any
mm,
of your, mostly private colleges have it, I feel.
mm,
Even
mm,
government colleges like BMC, where I live, Bangalore,
mm,
they also have these case presentations, or there's some event. Over
mm.
there, you'll have case presentation, poster presentation. So you have to
Okay.
choose whatever. You have to just enroll, pay some thousand rupees and
Mm,
enroll. And
mm,
you go to your professors, or either professors or assistant professor, anyone, and tell them, do you have a good case in the
mm,
hospital? Or
mm.
you just ask them, like a rare
Okay.
case or a good case, which is nice and which is
Okay.
something not seen before. So they will tell
Okay.
you this case has come. So what you have to do is you have to research about that. Research means you just type that example. We put any topic. You type it in Google
Mm.
and check research papers under it. Okay,
Okay.
you'll get PubMed. PubMed has good research papers. Google
Mm.
Scholar has good research papers. You read
Okay.
around five of it in detail. They'll give
Mm.
you background abstract. Each different cases you'll get, right? From
Okay.
different authors. You read
Okay.
and you'll get little minor differences between each case. Example, one symptom this patient had, the other patient didn't have, but certain findings, right, will be very similar. Same
Mm.
thing, keeping that in mind structure, you can start writing your abstract. Abstract is something where you submit to the college,
Mm.
having your introduction or a background, saying what
Okay.
condition it is. Then you
Mm.
have your case study or your materials, which is the
Okay.
patient so and so came with so and so
Mm.
complaints, and we are suspecting this. Then
Mm.
you write about your discussion if you want to. You can write abstract if you want to, or and then you conclude what you want to tell. What is your message through this? Like,
Mm.
how is this research paper helping you to do to good to the society or to the community?
Okay, the first thing is we should keep in update about the events happening in your state, right? Like it might be in any top of the colleges.
Yeah, you'll get to know that
Uh,
you have to have a good
yeah.
connect. One thing.
Then second thing is once you get to know about there is some event happening, then you should get registered and approach your teacher. Like it might be associate teacher.
Yeah,
Then later on you should ask them for any specific or rare
anything.
cases. Hmm. Then later on you should research by yourself. Like it might be using some resources on internet like Google Scholar, right? And next thing is you should
PubMed.
write yeah, next thing is you should extract and I mean integrate all those things together and
Correct.
prepare your own, right? Then
Yes.
that's it.
In any college,
Hmm.
once you have to have consent, the patient's consent form, and to actually get the case file itself, you have to write letter to the dean or the principal to get the
Hmm.
consent. So that is little hard job, because I have to, if I had this case, example, my Manipal case I presented, I had to go
Hmm.
to 3 4 departments. Each department had to get the care. Example, my
Hmm.
case, which is plexiform neurofibroma,
Hmm.
um, it was a surgery case because surgery was the treatment done for it.
Okay.
Over there, I had to get the surgeon's approval. I had to go to
Approval.
pathology because the diagnosed by pathologist, right?
Hmm.
So that is one tedious job because you have to run.
Yeah.
You have to run, go there, classes little bit, and once you do around 2 3, right, you get the hang of it.
Hmm. Yeah.
And one more thing is that one thing which I have noticed in from my other friends colleges,
Hmm.
usually these mostly the teachers, right, they don't promote doing case presentation, case research now as a UG, because
Hmm.
we're still young, we're still not yet exposed.
Yeah.
Usually it's a final year thing,
Yeah.
because you're going to PG, research PG, it's case presentations, right?
Yeah.
So I feel that is one drawback. You have to, like, if any
Yeah.
teacher is very into about certain things. In my college, luckily, people are very focused on research.
Yeah.
They keep
That's
promoting
that.
people, go
That's
for,
the thing which
they push.
majorly happens in private, because in government they are
Yeah,
least interested about all these things, whether it might be anything related to academics. Like if any of the fest comes or
Yeah.
any other programs comes, all will be high. But related to academics, no one will be much more concerned. But if any of you are still watching this video,
Hmm.
really you are going to benefit from this video, and thank you so much for watching this. And I will be sharing the case presentation of Tanya on the screen. You could go through that, or I'll be just sharing the link in the description, so you can check through that and you will getting a outline about how you should be doing that. Okay, Tanya, let's talk upon poster presentation. What's this poster presentation? It's just like drawing, or it's something which is very different?
Presentation is in the PPT format, right?
Okay.
How your lecturers make PPT, you put the same thing as the PPT and you attach pictures with it. Same thing.
Okay.
But poster presentation is in one entire poster, you will get
Hmm.
inside of everything. One side, it'll
Okay.
start with title, it'll start with
Hmm.
introduction,
Hmm.
background, then
Hmm.
material required, discussion, conclusion, your references. So
Hmm.
it's like one page. Example, you take an A3 page and you put 3-4 pictures. So
Hmm.
it gives
Yeah.
an idea at one glance. You have
It's
everything written. The
combined.
presentation,
Okay.
yeah, it's a concise word.
Hmm.
So PPT means it keeps going. Around 15 to
Hmm.
20 slides you have.
I get it. Get
It
it.
keeps going. So this is only about one case. When it
Hmm.
comes to research, it's
Hmm.
about multiple cases,
Okay.
right?
Hmm.
When you say research, it's a multiple. When you say case
Hmm.
presentation, it's only one case.
Yeah.
But I would prefer like you can start with case presentation, which is only about
Hmm.
one case,
Hmm.
and slowly go towards the research side. Research is basically you have your materials, like your case, your
Hmm.
multiple cases about one disease,
Hmm.
and you try finding something new which others
Okay.
wouldn't have found, or
Yeah,
the
that's the research,
correlation
right?
between new things.
Ah.
That is research. That is you
Hmm.
yourself are trying to put. It's most you have statistics also involved in it,
Hmm.
like how many percentage of these people had this symptom, or how many people experienced this, what
Hmm.
medication worked for them, which was better.
Yeah.
So research is very advanced. I think
Hmm.
starting with case presentation is a good idea, then
Hmm.
slowly going to research.
Uh,
Yeah, that is what it is.
what's about that ICMR? I have heard a lot of times students talking about ICMR. So what's it? Can you please tell it to the audience or me?
So ICMR is like a research head
Okay.
for research head in India.
Hmm.
So, and like every year they come up with all these, they have these
Hmm.
certain
Okay.
applications for first year, second year students, third year, fourth year, any year. And you have to write your abstract, whichever
Hmm.
you're interested in. And it's a
Hmm.
case series, or I would say many cases. You
Hmm.
have to, it research means you have many
Can
cases,
you
right? So you,
can you just give example explaining this research thing? Taking an example, like you are doing some research on HIV patients. Like, can you please explain that thing? Like how we can start research on in that thing?
hmm. So example, you take HIV is a very broad topic, right? In
Yeah.
HIV, what you're looking for, it matters. Like example, you were saying HIV treatment wise. See, the thing is
Hmm.
that the topics in ICMR, they already have told you certain headings, like
Hmm.
like you have to do the environmental diseases, or occupational diseases, or the major health problems like diabetes,
Hmm.
hypertension. They've already given you like the topics.
Hmm.
Those things you have to choose, and under
Hmm.
that also you have to choose very specific. You have to be very specific. You can't be very generalized. Like in malaria, what you're trying to do, or in diabetes, what are you
Hmm.
comparing? Because diabetes will cause so many complications, and that what which complication you're doing, or renal complication. Example, you take diabetes. So
Hmm.
you're talking about effects of diabetes, like kidney. What effect
Hmm.
it has in the kidney? Okay, if you
Hmm.
take a biopsy, a certain people have different stages of kidney diseases,
Yeah.
right? So you take around 40-50 patients, and you see
Hmm.
each patient what all different kidney changes you have, right?
Yeah.
By pathology. So that's how, and you see that certain things are very new. You will read research papers, but in
Hmm.
your patients are different, right? So
Hmm.
each patient has its own, no two patients can have the same symptoms, same things, right? They'll have one or two difference, and even the
Yeah.
severity will be different. So you can compare those parameters with statistics, and you write an abstract and you send it to ICMR. And this is all over India.
Okay.
So if you're lucky enough, and if your research is too good, and ICMR will select it, then
Hmm.
you get a scholarship also. Okay.
Scholarship, yeah.
They
What's the amount of scholarship
get
that you will be get?
60,000. That will be given in three settings, I think. 20,
Hmm.
20,000. And that's for
Okay.
you for using for your research. You can use it
Hmm.
as your research, whatever cost you have. Because certain test, example, you're screening for something in a particular place,
Hmm.
right? Any disease screening like malaria or whatever. You have this test kits, etc. For those and all you need, it will charge. So
Yeah.
that it they will do, and they will publish under ICMR. And getting a publication under ICMR is a huge thing for
Yeah.
with respect to CV also.
Hmm.
It's a very huge thing because it will have an impact in your career.
Distinction in first year, second year. So hopefully you are in a third year, and it's going to be a hat trick to you. And the major thing is it's a very huge syllabus, right? Getting passing
Hmm.
marks is a very big deal, like most of us medical students feel. So how did you manage getting distinction? Because it's not a very common thing which majority of the medical students get distinction in first year as well as second year. So how did you cope up with the academics? I mean, what's your technique of studying or anything it might be which you like to share?
So for me, I feel I'm very interested usually to study the new topics first thing,
Hmm.
and like I'm not saying that I study every day or anything like that, but I
Hmm.
like it. Sometimes I do study. I'll finish it the day whenever it's taught. See, first thing I feel people neglect is concentrating in class. You know,
Yeah.
it's something if the lecturer is good, if the lecturer actually is making an effort and teaching you,
Hmm.
I feel concentrating it just finishes your 50% of your studies, or
Yeah, more
writing
of
it
the
down.
it's not the
Uh,
subject, but I think it's the teacher always. Like if you are not getting interest in a particular subject, it's mostly the teacher. Because if the teacher is teaching you in a way which is very joyful, then certainly ultimately
mm,
the interest in that subject will develop, even though if you are not interested, but because of the teacher it might develop. So this is something which I think.
teacher, I feel there is a contribution, but I feel even
See,
self
and one
lot.
yeah, you know, even
Yeah.
one more thing which I like to add, like we mostly go to classes, right? But majority of us would prefer watching Marrow, Prep Ladder, all these edtech platforms. It's just because we love the teachers over there. It's not the subject, but we love the teachers over there. So that's the point that I'm telling, that it's always the teacher, not the subject. So how
So
did
yeah, I
you?
mean those platforms. Yeah, I mean.
I mean, how did you score such good? That's what.
I feel it just see I do revisions, like try finding certain shortcuts for each thing. Each few of them have mnemonics to study,
Hmm.
and first year was little hard for me actually.
Hmm.
I didn't score like a distinction. It was a 74.9. Okay,
74.9.
so
It's
almost,
almost like a distinction.
yeah,
Let's consider a
yeah.
distinction.
It is
Point five.
yeah,
Hmm. Hmm.
yes. So that is one thing. It is for me. First year was very hard because it was only books. But
Hmm.
second year, it was who pays attention in clinicals more than
Hmm.
the classes. And I should talk to patients, etc. I used to take cases after my classes is over, read about the case and then take the class. So I feel when you're integrated with all the other subjects, right, then
Hmm.
second year will become very easy. Because
Okay.
pharmac, the medicine wise, pharmac is boring. I agree. It's very boring
Hmm.
when you're staying. But
Yeah.
certain things I feel small things you'll remember. Example, easy
Hmm.
say for fever it's paracetamol or anything diclofenac for soft tissue injury. You will remember when they apply lignocaine. You'll see in the ward
Hmm.
how much lignocaine they'll keep pouring.
Hmm.
They'll be like put more. You know. So you'll
Yeah.
see that you'll see the normal saline drips will be going. Some drugs will be going. You will see some this one MDI. So looking looking at that, then you can correlate.
So moving on to the next thing, let's talk about one of the most important thing to me, especially because I'm so much of interested in content creation than my academics to a certain point. So let's hear from Tanya, because even she has started sharing videos on YouTube recently. So you can just go and check out her channel. I will be giving a link in the description. So let's hear from her what's her motive of starting a YouTube channel, or what's her future plans for the YouTube.
So I started, I wanted to start YouTube for a very long time, but then finally I gave it a shot. So because I feel like I'm doing okay, good in academics, and I've started a lot of research and case presentation. So I feel there are certain things like you should work in a certain way, or like tips or anything of ideas, etc., and which makes things very easy and organized. So I thought of sharing my bit of that to people, to make things, their life much easier, and to find a balanced life, actually, work
Yeah.
life balance in MBBS.
Yeah, it's very important that you should have some side hustle, because this is not something which will keep you motivated all through this MBBS, because there should be something which should be like a
Yeah,
kind of stress buster. Like it might be playing any of the instruments, or it might be anything other things
yeah.
related to sports or even the YouTube. So that's it. And what would you like to give one message to the first year, second year students who are watching this? A last message, so that it will be end of this video and really helpful for them.
So I feel that one thing is being motivated all the time is it's impossible, and you have to keep pushing yourself, find motivation in any part of it, like your YouTube videos or your shorts, your reels, and know the purpose why you've come here. And recently also you very well said, you told that we're always looking for the outcome, and more we're not going through the process. I feel don't think too much of the outcome, just enjoy the process. Soon even
Yeah.
this will be over, so just be consistent, and don't it's okay if you're not consistent a few days. Even I do it by myself, and so many people do it. It's okay, but just know why you're here, and value what you have, because many of them don't have what they have, what they wanted,
Yeah.
and you have
Yeah.
it. So yeah, just make use of every little bit of it. Yeah, knowing that don't do it when it's too late. Just be early.
Yeah. So that's it, guys. It has been very great time talking with Tanya, and I really look forward for more such content coming from Tanya. And it has been a great time talking with each other and making this video. So what was your take, Tanya? How did you feel?
It was really nice, actually, because I've never done this before. And sharing my experience on research and academics was really nice. And hope someone finds, someone takes home all these small points which I have mentioned. And hopefully, we do more of these videos. Looking forward for more of it. And if you guys have any questions, just feel free to ask in the comment section. Thank you,
Yeah, you
guys.
can. Yeah, for any such queries, you can just comment down below this video, or you can check out her channel where you can put up your comments. So she will be very happy to answer all your queries. So that's it. See you in next video. Have a nice day.